Anyone who does breast reconstruction will tell you that insurance coverage is getting trickier and trickier for breast reconstruction, which is crazy considering the fact that breast reconstruction is mandated to be covered by insurance. But the insurance company likes to do little tricky things that prevent them from having to cover certain aspects of surgery. Let me give you an example of what happened to me and my patient today. So I'm doing a direct-to-implant reconstruction tomorrow. It is a patient who will need radiation, so there can be no delay in her cancer care. She needs her mastectomy and reconstruction tomorrow. This case has been scheduled for weeks. And yesterday, we got an email from the insurance company saying that the mesh that I wanted to use was not approved. They weren't going to cover it. So they said I could use it, but the patient could potentially get a bill for it, which would be tens of thousands of dollars. They gave me some options of things I could use, things that aren't available at my institution, so not super helpful. So we set up an urgent peer-to-peer. The definition of a peer-to-peer is that I am supposed to discuss the case with my peer. So when I use vernacular and terminology and statistics and cite literature, they understand where I'm coming from and why I want to do what I am asking to do, what I'm proposing to do for this patient. So today I had my peer-to-peer, and my peer was a physical medicine and rehabilitation doctor. That's not a peer. When I started talking about things like seromas and infections and needing this patient to get to radiation, he had no idea what I was talking about. So I asked to speak to a manager. I asked to expedite my case. Oh, he can't do that. We have to put in an expedited appeal. So we put in an expedited appeal. This is at 1 p.m. My case is tomorrow at 7:30. The patient doesn't know this yet. So I have to call the patient at this point and explain that I still want to do a direct implant reconstruction, but I'm concerned that I'm not able to do it the way that I deem best. I'm not able to use the tools that I want to use. The patient understood. We still plan to proceed. I was going to use an alternative, which I didn't love, but what can you do? The surgery's tomorrow. And then we get a call back from the insurance company saying, hey, you know what? We'll give you a one-time waiver. You can use mesh that you want to on this patient. So that's a great win for this patient. But you know who it's not a win for? Every patient that comes after her that needs a direct-to-implant reconstruction and has this fairly common insurance. This is disappointing. Insurance companies need to do better. Patients, we are advocating on your behalf. If you've seen videos on social media, this theme is all over social media. What can you do as a patient? Continue to advocate, continue to lobby against the insurance company if they're saying no, and just remember that as your surgeons, we are fighting for you. We are trying our best. It's just we are fighting against a failing system.